Our last speaker of the session is Mr. Walid Fleihan. Mr. Walid is MI clinical education expert at the GE Healthcare, having more than 14 years of experience in this field. I will invite him for presentation on towards precision in nuclear medicine processing. Mr. Walid Fleihan.
Thank you, Dr. Asif. Good morning, everyone. I want to thank PSNM committee for giving us the opportunity to address you with our latest innovations. You know, as GE Healthcare covers the whole molecular imaging line of business, from pharmaceuticals to cyclotron to imaging equipments, digital or analog, PET-MR, PET-CT, SPECT, SPECT-CT, to workstations, AW for PET, Xeleris for nuclear medicine, and recently we acquired the MIM solution. Allow me, before I start with my presentation, to share with you a couple of innovations that were recently launched with the GE. If you're following the European Society of Nuclear Medicine conference last week, we have launched the new SPECT-CT, the Aurora. Please, if you can take some time later to check the social media highlights for this new innovation. And another innovation from the pharmaceutical part, which we have been waiting for a long time, we got the FDA approval for the fluoropyridaz. This is a fluorine-based cardiac pharmaceutical. Hopefully, it will be a game changer in cardiac imaging with the PET-CTs. So the challenge was using the ammonia and the rubidium, which is very expensive and very less available in our region, specifically no cyclotron with every system or equipment. And now having it a fluorine-based, it will be much easier, cost-effective, and reachable for all the departments. Now let's start up with the presentation entitled Under Towards Precision Nuclear Medicine Processing. Under the GE Healthcare slogan of Precision Health, we will speak about the Xeleris V, virtually transforming the way you work. Our presentation will cover three main offerings, the Xeleris Enterprise Server, the Smart Subscription, and our advanced AI applications. Starting with the Enterprise Server, the main challenges in our workflows nowadays, having multiple workstations that require IT management, having variation in the capabilities that results in extra training, and the lack of access and ability to read from anywhere using the same tools decreases our productivity levels. What GE Healthcare is offering is single installation enabling integration with board access, consistency, and scalability. Having access to the same tools and applications from anywhere within the department and network, having centralized management, configuration, and customization to share with all across the clients, and we have a scalable solution with up to 10 concurrent uses. Second, we go for smart subscription offering. Also, the challenges that we're facing nowadays, that from the time the workstation is ordered, it starts to fall behind technologically. The purchases made over time result in different capabilities in different locations, and the variation in the capabilities will result in extra training and different clinical applications. Solution comes with a smart subscription in 4 categories, having advanced applications, offering latest advanced applications in packages like cardiac package, neuro package, etc. The platform, there is no one hardware to service. The end user interacts with the thin client. GE will be managing the hardware and its software updates from end to end. Customer IT will deploy the users as needed. All updates on the solution are deployed centrally, saving IT time and labor, and no need to worry about serviceability. In other words, whenever you buy a workstation, it comes with many applications with a specific version. So whenever GE will launch any update, any fixation, any new version, it will be automatically updated on your server, and you will be having always up-to-date workstation. Third part about advanced applications, we have 6 main applications. If we can classify them, the first 4 will be GE applications. The last 2 will be more to a third-party applications. The first one, we will go deep dive in each application, the Q-Lung AI. Usually, the intention of the lung imaging in SPECT-CT is lung cancer, lung volumetry, and pulmonary embolism. Our challenges mean time in the workflows is the manual lung segmentation, which is time consuming and operator dependent. The accuracy and the consistent assessment of the lobe perfusion on SPECT-CT images could alter the number of candidates for surgery. You know, the actual 3D geometry of the lung cannot be assessed accurately with the 2D nature of planar imaging. So we need a 3D imaging, and basically whenever you have the CT with the SPECT, it will display the proper anatomy of the lung. The mismatch calculation between ventilation and perfusion was not perfectly accurate, and it is highly operator dependent. Our solution is a comprehensive SPECT-CT application, including automatic lung lobe segmentation for pre-operative lung assessment and pulmonary embolism diagnosis. With the QLang AI, it offers a deep learning-based SPECT-CT lung lobe segmentation. You don't need to have any operator-dependent segmentation, fast, reproducible lung lobe segment analysis, and the guided auto-analysis of a quantitative lobal and lung function. As well, it offers trachea segment masking for pulmonary embolism evaluation. We were able to reach 89% of successful rate of automatic lung segmentation and 57% reduction in the number of clicks. Second, the Q-liver. This is main intent for CERT. CERT is generally applied to selected patients with surgically unresectable cancers, especially the hepatocellular carcinoma or metastasis to the liver. As you know, the treatment involves injecting tiny microspheres of radioactive material into the arteries that supply the tumor. Challenges nowadays, the manual segmentation is time consuming for the liver. The liver to lung shunt calculation as well is on planar images and not perfectly done and user dependent. The manual dose calculation, it is usually based on many factors from liver volume, the BSA, and the shunt, and this will be requiring multiple tools to calculate the recommended dose. Now with our solution, it is a streamlined solution to facilitate selective internal radiation therapy, CERT, treatment planning. It will be offering automatic liver, lung, and tumor segmentation. It will be having automatic liver to lung shunt calculation. It will provide tools to aid in therapeutic dose calculation. So Q-liver will be a one-stop shop for processing, quantifying, and reviewing liver SPECT-CT, as well as tools provided to user to help the calculate of therapeutic CERT treatment doses using a user-defined formulas. This is very important. If you have some researches, you can build up your formula or edit the existing formula and utilize it for your calculation. We were able to reach 47% average time reduction and 90% average reduction in number of clicks to achieve those calculations. As well, 52% average time reduction in the liver segmentation. Q-Therra AI, its main purpose is for thermostics, our new technology for nuclear medicine. Challenges nowadays, as well, manual segmentation, processing and analysis may not be offered in one streamed workflow, and those assessment, the laborious and tedious methods for those assessment challenges. Solution end-to-end application designed to automatically segment patient organs and lesions, automatically quantify and calculate the percent of injected dose, automatically calculate and report the absorbed dose. Q-Therra AI is goal to simplify the process and to help save you time while providing clear results. Q-Volumetrics AI, it is an enhanced advanced segmentation and quantification capabilities for SPECT-CT data without embedding workflow for both baseline and longitudinal studies. The reconstruction is a complete reconstruction, full reconstruction with attenuation, scatter, and resolution compensation. This push our images for better SUV values accuracy at the end. Automatic method for liver, kidney, bone, lung, and many organs. In one click, you can able to segment these organs. Now to the third-party applications, we have the Xeni bone. Mostly it is intended for any cancer that involves the skeletal metastasis, mainly the prostate cancer nowadays, and also the breast cancer. The challenge is there is no standard established to evaluate and interpret whole body scintigraphy. It ends up having low reproducibility, time-consuming process, and high inter-observer variability. With the Xenobone, it is a fully quantitative assessment solution of bone scans empowered by AI, automates the lesions marking and calculation of bone scan index. With the Xenobone, it is enabled with AI to mark the lesions and quantify the disease burden. The automatic BSI will overcome the limitations of subjective visual read and provides an accurate, quantitative, and reproducible assessment. So it will be AI-assisted, fast assessment, and high reproducibility. In the cardiac applications, the challenges, as you know, the cardiac is one of the most fatal disease, and maybe it will be covering 31% of the whole global death. So several factors may impact the diagnostic accuracy of myocardial perfusion imaging. It will be related to patient anatomy, nuclear medicine limitations on processing and reviewing technology. With MyOvation today, our application, in addition of what it is being available in the market now, having the patients with suspected or non-coronary artery disease reconstruct and reformat SPECT's raw data and helps to analyze myocardial perfusion and function in rest, stress, viability. Now we are using specific AI algorithm for detection of heart location and alignment. This algorithm will detect the location, reorient the images to short axis, horizontal long axis, and vertical long axis. These reoriented images are used for analysis. It will be automatic. It will be a perfect alignment between stress and rest, and this will provide very good display for the images. With the latest innovation in nuclear cardiology, in order to bring more innovative clinical applications, GE has partnership with the experts in third-party cardiac softwares, Cedars-Sinai, Emory Toolbox, and the Ford DM Corridor, which comes from Invia Medical Imaging Solutions. As you know, each application has special features, has different normal database. In Xalaris V, we will embed seamlessly these three-party applications into the Xalaris platform. Thank you.